Hello, people. Good morning, good evening, good afternoon. Take the goodness wherever you are. We are back again. This is Open Heart with Oluchi. My name is Oluchi Emekaekwue. I am the host. And I want to thank everyone, first of all, for the subscription, for the messages, for the emails, for the advice. I appreciate everybody. Thank you guys. Thank you guys for the updates. Why are you not talking since this one, that one? We are back now. We know that life is not that easy. Sometimes you have a lot of things keeping you down one side, so you forget about the other side of the world. But we are back. So today we want to be talking about something very, very important. Today we want to be talking about mental illness. Mental illness. No be madness, so no be proper madness. We have a professional in our midst that will give us a lowdown about mental illness. In our midst today, we have Dr. Mrs. Chioma Obiku, all the way from the United States of America, that will be talking about this mental illness. Hello.
Hi, how are you?
I'm fine, and you?
I'm okay.
Oh, good, good,
I'm
good. We are
okay.
happy to have you in our midst today.
Thank you very much.
All right. So, want to know, want to tell people about mental illness. Personally, I want to understand it too.
Yes,
We have, yeah.
yes.
So, what is mental illness?
Okay. First of all, I have to thank you for this wonderful opportunity.
Thank you.
I am very, very grateful. And I am happy to just try to introduce to you and to the whole world and the
Mhm.
viewers about mental illness. Like you have said, I'm Dr. Mrs. Chioma Obiuku, and this is my area. I've
Yeah.
been in this for so many years. I actually run a
Wow.
clinic both here in
Wow.
United States and in Nigeria. So,
Mm.
like you said, life is full
Mm.
of obstacles, everything, and we tend to ignore other things.
Mhm.
So,
Mhm.
this is an area that I will want people to look into as it affects everybody.
Yeah.
Not just one particular group or one particular tribe, it's all over.
Mm.
And this thing we call mental illness is a disorder. It affects
Mm.
your mood,
Mm.
it affects your thinking,
Mm.
it affects your behavior, and it
Mm.
involves a lot.
Yeah.
Just like in medical, people have different kinds of illnesses. That's the
Mm.
way it is in mental illness. There are different kinds,
Mm. Wow.
but they have to come to you. They
Mm.
have to present their symptoms
Mm-hmm.
for you to be able to diagnose accurately what the problem is.
Mm.
And once you're able to know what the problem is, then
Mm.
you go for treatment.
All right. Oh,
Again,
you're
there are
saying,
treatments.
oh, there are treatment for it.
There are treatments for it.
Oh, okay. Are you saying that they have different stages or different types? I don't know.
Yes, we have different types, and there are
Oh,
different stages as well.
all right.
And the
Oh,
stages goes when there's a problem, I ignore it.
mm-hmm.
It tends to expand,
Mm-hmm.
and if not treated, it becomes more problem.
Okay.
So
Okay.
the
Like,
early identification helps us to
yeah,
prevent that long-term effect.
yeah. Mm, yeah, good. Like they said that earlier, the early detection in every illness
Yes,
gives room for treatment and
yes,
quick recovery. Yeah,
yes.
yeah. Thank you so much, Dr. Chama.
You're
Like you
welcome.
said, they have different types. Can
Yes.
you throw more lights on that? As in what and what? And can you tell people the symptoms? You know
Yes.
what I mean? Mm-hmm.
Yes. First of all, I have to also let the viewers know that it can happen to an adult, it can happen to children as well. So
Mm.
it's not excluded to any particular age group.
Good. Oh, this one.
Yes.
Mm.
There's depression,
Mm-hmm.
there is anxiety,
Mm-hmm.
there's bipolar disorders,
Mm.
personality disorders,
Mm.
schizophrenia,
Wow.
schizoaffective disorders,
Mm.
eating disorders,
Mm.
and substance abuse.
Okay. Wow, they have loads.
There are loads,
Yeah,
and
they've
each
got
and every one
loads.
of them can branch out.
Yeah.
Yeah,
Okay. Okay. The only three I know is the depression part, then anxiety, and the
anxiety.
substance one. I know
Mm.
every other one. I'm just hearing it for the first time.
Yes,
Yeah, knowledge is
yes,
power, they say.
yes.
Yeah, I don't know about every. I know just three: the depression part and the
The
substance one
anxiety.
and the anxiety. Yeah,
Yes,
those are the three I know. It's
yes.
good to learn. It's good to listen and learn from
Mm-hmm.
the professionals. Yeah, thank you so much. Thank you
You're
so much.
welcome.
So, what do you think can cause all these things?
Again, there's no sometimes you say there's no known cause of mental illness, but it can be genetics,
Mm.
it can be environmental too.
Oh,
Yes,
genetic.
yes, genetics. It runs in families.
Okay, okay. Again, it that means that everything runs in the family. Because most times when you go to the hospital, they tell you have history of blah 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 blah. You know what I mean?
Most likely, most likely. That's why we get a history. Each time you get a patient, you get a
Oh,
history, a family history.
yeah.
Mm,
If they have maybe grandfather,
mm,
grandmother, blah blah blah,
mhm,
mother,
mm.
sister that have gone past through such thing.
Yes, yes,
Okay. So
yeah,
mental illness falls in the same route too.
it does. It
Oh,
does. It does. It
oh,
can also be caused by activities in life.
like
Yeah,
from the depression side of it. Yeah.
yes, yes. And other things
Okay.
that must have happened to you, which you might not, you might not be the cause. That's what we call trauma.
Hmm.
Yeah. Oluchi, can you pause this?
Okay.
Can you pause for a little bit?
Okay.
Yeah,
All right. So good.
yeah,
Thank you so much for throwing more lights on it.
yeah, yeah.
What do you think that people can do? Like, no, apart from depression and anxiety, there are on a layman's understanding. Can you tell me what other side of mental illness? Because when we talk about mental illness, some people will say madness. You know what I mean?
Yes,
On a layman's understanding,
yes.
like maybe on our Niger understand or African understand, I say the person they mad. You understand what I mean?
Mm-hmm, mm-hmm,
Mhm.
mm-hmm.
So what can depression lead to madness? I don't want to put it that way. You know what? You
It,
understand what I mean?
it depends on what you mean by madness. Remember when I started, I had mentioned that is a mental is a disorder that affects our mood, it affects the behavior, it
Mm-hmm.
affects the thinking part of it.
Mm-hmm.
So in our own term, like how Nigeria say this person they mad.
Uh-huh.
If you observe them, you find out that their thinking is not what it's supposed to be,
Your brain.
and their behavior is out of the norm.
Mm.
Is not what it's supposed to be. That's so in a way, yes, it
In
is
a
what
way,
we call the
yes.
madness. Yes, because
Mm.
like I said, their thinking is off. their behavior is off.
It's odd.
Yeah.
Yeah.
And most of the times you observe that those people that are going through that, they don't know what is happening to them. So
Yeah.
it's the family members that can actually say, oh my God, I think there is something that is wrong with this
Yeah.
person. Yeah.
Exactly.
Yeah.
Exactly.
Yeah.
Okay. Now I understand because different things for different folks. You know what I mean?
Mm-hmm.
Um, in the civilized world, like where we are now, where you are, they call it mental illness. But
Mm-hmm.
in Africa, they go say person don't dey kolo.
Yes. Yes.
Other person is on colos, like you mentioned, substance, the
Yes.
substance side of it. You understand?
Yes. Mm-hmm.
So it all falls under mental illness. Is
They
that
all
so?
fall under mental illness. Yes, they all fall
Oh,
under the big umbrella of mental health illness, and then it
okay,
branches out, yeah, to
okay,
different areas.
all right.
Yeah,
Oh,
it
now
is a big topic. It's diverse, just like medical is diverse. So it's not something that you can just come in and you digest in 1 second or just one
yeah.
topic. Something that has to be done bit by bit. Because I want people to really understand
Mm-hmm.
this, no early detection,
Mm-hmm.
and also be aware that there is treatment. And of course, with mental illness, you know how it is. People do suffer from it, but because of the stigma attached to it, they don't want to talk about it. So I want people to be able to know what it is,
Mm-hmm.
how to look out for it, to be able to identify it, even like in
Mm-hmm.
children too, so that you can help them to do better.
Oh, they have it in children too.
Of course, yes.
Wow, wow, wow. This is serious. This is serious. Oh, anyway, life do happen, like people used to say.
Yes.
But from my own understanding, like I said, the colos one on on colos or depression, like you said, there are ones that can be there's remedy for it. That's the good part of the story now.
Yes.
There's remedy, there is cure
Yes.
for
There
it.
is treatment. Yeah.
So
There
there's
is
treatment for
treatment.
it. But
Yeah.
the treatment, does it clear it finally, or it goes and comes? Sometimes, you know what I mean?
It might, and at the same time, it might not too. It depends on individual and it depends on how long they have had it. Some
Okay.
might get out of it and be able to do and go about their normal life.
Mm-hmm.
Some are chronic. You only have
Mm,
to manage it.
mm,
Yeah.
mm. Well, like which part of this mental illness that falls into the chronic side? Because I know the depression one, some people might go through a therapist like you,
Mm-hmm.
and
Mm-hmm.
they'll come out of it like the
Mm-hmm.
anxiety part of it, of the mental
Mm-hmm.
illness. But
Mm-hmm.
I'm talking about, let's say, about this one, this colos one. Sometimes they after treating getting the treatment, they'll go back to what's got them in there.
Mm-hmm.
Do you what
Yeah.
can be done?
Yeah, like I said, most of them are just they're chronic. They are just there. You have to
Mm,
manage it, and
managing.
management is through medication and then therapy. You can go about
Mm,
doing your normal life, do what you
mm,
have to do, but you have
yes.
to take medication in
Mm,
order to function,
function, yeah.
in order to do
Mm,
better.
yeah.
Again, it's not that I'm comparing with medical illness. Some medical illnesses are chronic. Somebody that has hypertension or somebody that has
Mm,
diabetes,
mm.
unless it's cured by God, because there's nothing God cannot do, unless it's
Cannot do.
cured. Otherwise, with medications, it's manageable. You can manage
Mm,
it. When it's environmental, when you
mm,
take out that piece
yeah.
that causes that illness, that causes the depression, that causes the anxiety, people might do better.
Mm. Oh, 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 oh,
Yeah,
yeah.
if it is genetic, it's there. You're not gonna snap it out. You can wash it away. Again, unless God steps in. and heals you completely.
Yeah, when it's genetic.
When his genetic is there, is a part of that individual.
Yes, because I could remember I had a schoolmate that the hers was genetic
Yes.
from what we later learned.
Found that.
That
Yeah.
it started from the mother had it, the grandmother had it, the mother had it, and out of the two sisters, there were two sisters, then the other ones are boys. She's the only one that got it.
Mm.
So, but it comes and goes.
Yes.
It's
Yeah.
not
There's
steady.
also, yeah, sorry to cut you short. There's also the ones that are seasonal.
Okay. There's also what?
The ones that are seasonal. We call it seasonal affective disorder. At some point in season, it comes on. When that season is over,
Yeah, yeah,
they feel
yeah,
better.
yeah.
Yeah.
Just like the lady I'm talking about. Her own
Yes.
is like it comes, it
Yeah.
goes, maybe sometimes
Mm-hmm.
once in
Mm-hmm.
a year, sometimes once
Mm-hmm.
in 2 years, sometimes
Mm-hmm.
even two times in a year.
Yes.
It
Yes.
comes, and
Yes.
whenever
Yes.
it comes, she goes
Mm-hmm.
out of the system.
Mm-hmm. Yes.
Mm,
Some are
yeah.
postpartum. Postpartum, it could be postpartum depression, it could be postpartum psychosis. After having a
Mm.
baby, the trauma, the
Oh, yeah.
stress will trigger it.
Okay. Yeah,
Yes,
yeah.
and after some time, you see them, they start feeling better again.
Yeah, I've seen,
Yeah.
yeah, that
Mm-hmm.
this one, yeah, when I had my son, I saw somebody after giving birth, they let
Mm-hmm.
this made her
Yeah.
stay back in the hospital
Mm-hmm.
because she
Yes.
was eating her lips.
Yes.
They said it's something postpartum
Mm-hmm.
mental illness.
Yes.
So she was misbehaving generally. They said they know her, this is her third child, that she will get over it with time. They don't want her to go back home because she might harm the child or harm herself.
Uh-huh.
So they were like
Yes.
giving her medications. Yeah, 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 it's true. Wow. Oh,
Yes.
life is serious sometimes. Some people will say life is not serious, but sometimes when you look at what people pass through, you know that
Yes.
yeah, sometimes life is
Mm-hmm.
serious. Thank you
Yes.
so much, Dr.
Yes.
Chioma Obiuku. We sincerely appreciate. But what do
You're
you
welcome.
think? Maybe next time we'll be talking about the stigma. Let's
Yes.
maybe next
Yes.
one we'll be talking about the stigma
Yes.
because I know that stigma attached to this.
Attached to it. Yes.
So, but I
Yes.
want to ask, what do you think people can do? What's like people that are in the situation, apart from you being a doctor that takes care of them or give them the therapy? What do you think the person involved can do on his or her own?
What they can do on their own is to try once you find out that there's a problem, because you will know. And when those people cannot find out, the family members or friends can find out, you just have to look for a medical provider.
Okay.
You have to look for a medical provider. In a lay term,
Mm,
people call us shrink, people that treat
mm,
mental illness. So you try to take them to an expert who
mhm,
can actually see the patient, be able to diagnose the patient, and formulate the right treatment for the patient.
mm.
Yeah,
Oh,
that's that
good.
part. Mhm.
Oh, good. Thank you so much.
You're
Thank you
welcome.
so much, Dr. Chioma Obioko. I want to ask one more thing. This one, what about you? How do
What about me?
you, yeah, how do you cope with them? Like me on a layman's stand, me, I go be afraid though, my sister.
I know, I know, I know. It is something to be afraid. It can be scary because most of the time
Yeah,
they act abnormal. Most of the
yeah.
times, yes, it is something that is scary. But when you brought out yourself, you made up your mind that this group of people also need help. You'll be able to
Oh,
do it. Yeah. Let's say
bless
when
you.
you're in the hospital, we have staff. We have people that do help.
Mm,
If you're afraid to sit in a room with them, because you have to talk to them, you have to interview them, you have to know what is
Yeah.
going on. There are staff, they will have the security, we have mental health technicians, we have nurses, we have
Okay.
people that are there to support. Yeah.
Okay.
You
Yeah,
have
because
people
it's scary.
it is scary. Not all of them, not all of them are, scary. Some are pathetic. Some
Violence.
are you have to, yeah, some are very, very dear. You see them, you
Mm.
know that this person actually needs help. And it gladdens my heart. It makes me happy to see that these
Oh,
people can actually be helped and they can go
mm.
back to their normal
Normal
function
life.
and
Oh,
normal life. Yes. Yes.
yeah. Thank you so much. God bless
You're
you for that.
welcome.
It's
And
not,
you too.
you are doing a very, very great job. I must
Thank
tell
you.
you. You are doing
Thank you.
because my
Thank
sister,
you.
fear no go gree me come close. But all the same, as a professional, like you said, as
Yeah.
a professional,
Thank
you do
you.
your job and
Yes. Yeah.
yeah, leave
Yeah.
the rest for God. Thank you so,
Yeah.
so much
You're
for
welcome.
being
You're
our
welcome.
guest today.
You're
Hello,
welcome.
viewers. We've heard from our guest today,
Mm-hmm.
Dr. Mrs. Chioma Obiuku, all the way from the USA. She told us, she's been telling us about mental illness. Are you depressed? Are you falling? So many things, like she said, listen to this message. This thing is very important. If you find out that even if it's not you, maybe a sister, a brother, a relation, family member, colleague is not behaving well, is maybe some box, the person is not sounding, it does not behaving the mental illness have hit the person slightly, but the person might not know, like she said. Sometimes it might be misbehaving, but you won't know that this is happening to you. You can help the person. Be a ladder for that person to climb and get out of it. Get the person to the right channel, to a therapist, a doctor. When the person starts early, it will go a long way to help the person. Like Chomo, doctor told us now that early detection helps a lot. When it is noticed on time, start the treatment on time to go a long way to help the person. Thank you so much, our beautiful guest.
You're
We hope to
welcome.
have you some other time. Stay
Yes.
tuned, our viewers. Next time, we're
Yes.
talking about the stigma that
Yes.
is attached to this. Thank you
Yes.
so much, Dr.
You're
Mrs. Chomo.
welcome, my sister.
We hope
You're
to have you
welcome.
some other time.
Sure.
This is still Open Heart with Oluchi. My name is Oluchi Emekaekwue. See you next time. Bye, everybody. Bye
Okay.
bye.
Bye.
This is still Open Heart with Oluchi. We want you to click on the share button, like this, follow us on 14 TV, follow us on 14 TV, click on the notification button, like, share, and follow
Huh?
us. Thank you.
To the Charlie?
Bye.
Who's taking you? No.